Hi, this is Dr. Chumble. Let's talk about breast cosmetic procedures. So breast cosmetic procedures come in three different varieties, main groups of breast cosmetics. So you can make the breast larger, you can make the breast smaller, and you can lift the breast. Whether you're trying to make the breast smaller or larger, a breast lift can usually be combined with either of those options if you need one. People often ask, what kinds of incisions do you use on your breast cosmetic procedures? Well, that really depends on what kind of procedure you're seeking in the first place. Your surgeon will make you a custom plan based on your goals, and you'll be discussing what kinds of incisions you get, what size you want to be, and whether or not you need a breast lift to achieve a rejuvenated outcome. After breast surgery, it is really important to wear a bra for the amount of time your surgeon asks you to. I usually say about 6 weeks after surgery, and that's to help support your incisions as they're trying to heal. So the type of incision you receive will really depend on what kind of breast surgery you're pursuing. So if you're going for an augmentation alone, that can usually be achieved through a single inframammary incision or underneath the breast. It can be through an incision in the armpit or an incision around the areola or around the nipple areolar complex. There are choices and there are discussions that surgeons have with their patients in order to pick the correct one for that particular case. It all needs to be customized. For a breast lift or a reduction, the incisions can also vary depending on what you see on the patient. So for some of our larger reductions, we need an anchor-shaped incision, also called a wise pattern incision. But sometimes you can get away with keeping the incision just around the areola, and sometimes you can get away with just a lollipop incision or short scar techniques. So based on what anatomy you have and what your goals are, your surgeon should make you a customized plan for your surgery. If you're looking for a breast augmentation, that can come in a few varieties. You can use saline implants, you can use silicone implants, and in some cases, you can even use fat if you're looking for a modest outcome. And your own fat is what we would use here at Northland Plastic Surgery for that kind of procedure.